at Virginia Beach Vet Hospital, we pride ourselves in educating the client or the pet owner in how they, in certain diseases and why certain things happen. We don't like to just say, hey, your dog has this problem, and then take home these pills or this medication and then see how it works. Videos to help you understand why it happened, but these videos are also to help you know how to treat it properly. And one of the most common ones that we see here are ear infections, especially in dogs. 95% of the problem, or the solution to the problem, ends up being the client's responsibility. 5% is easy. I can tell you what's going on, but I need you to understand why it happened and what the treatment is and how we're going to treat it. Human sinuses and dog sinuses both have mucous membranes. Mucous membranes by definition mean that they have mucus or something that they secrete. And if you think in an ear, it secretes earwax. And those things are produced in excess when they're irritated in order to try to flush things away. So if a dog gets exposure to something they're allergic to and they happen to have a reaction inside their ear, the reaction is going to be inflammation inside the ear. It's going to be swelling, it's going to be itchiness, and a lot of excessive wax production. It's also important to understand that a dog's ear canal and a cat's ear canal are different than they are in a human. A human ear canal is basically it's a horizontal canal and drains very easily. A dog and a cat's ear canal is shaped like an L, and we've got this huge, big canal that's shaped basically like a funnel, and it's got a plug on it, which is the eardrum. As things fill up in there, it's very difficult for things to kind of come out. When the allergy occurs inside of an ear, you get inflammation and swelling and itching. That's the initial part. Then what happens is the dog wants to scratch it and may use its foot, may rub its face in the dirt, and what does it do? It inoculates bacteria and yeast inside there. What I want you to do is you fill the ear canal up with solution. And remember, it's shaped like an L. You need to fill it all the way up. These ear solutions, and these ear cleaning solutions rather, are designed specifically to float up debris and to clean the debris away from the walls of the ear. And in order for it to do that, you need to fill it up, but you need to have some agitation down there because it's almost impossible to get anything down here. So you squish on the outside, really agitate it, cause a little bit of suction, and then that will hopefully start breaking some of the debris away from the walls and float to the surface. Then you take a cotton ball or a square cotton pad, actually works better, and then you get down inside there and you really clean it out. You repeat it until you're getting practically no debris out. And hopefully once most of the debris is gone, then we put medication in, and we'll tell you which one to do. Some of them once a day, some of them are twice a day. But by putting the medication in, you also have to make sure that you get it down in there. Remember, we're trying to wash the wax and the debris away in order for the medication to hit the wall of the ear. That's it in a nutshell. It's really not that hard. It's just a matter of being diligent and following the directions. The final thing that we need to talk about is how important it is to recheck ears. We say, come back in 2 weeks or 3 weeks. It can take 3 weeks, 4 weeks sometimes to get ear infections under control. But you may see some improvement in a week or two. And a lot of times people will say, oh, I don't see it, this problem's gone, and then they don't bother to come back. And what's happened is there was a residual amount of infection left inside there, and many times we end up getting resistant organisms that actually make it more difficult to treat. So coming in for your recheck is super important. At that point, that's the point that we start addressing the allergy side, because if you don't address the allergy side of things, then unfortunately it will reoccur. So we will sometimes prescribe antihistamines, sometimes a long-term topical treatment. In certain cases, we can do some other diagnostics to try to figure out if this ends up being something they're eating or not. But that all comes later in the whole protocol.